In healthcare, the learning systems are often asked to do initiatives based on a problem that occurred or other things that have happened and wanting to improve practice, which is good. The hard part of that is, from a learning standpoint, we have to figure out, is that a learning problem or a management problem? What happens often is people may have problems with some one individual, but not want to address it from a management standpoint, which may include disciplinary process, and decide everybody needs to get education again. A great example of this that happens in healthcare systems all the time is a HIPAA violation, where somebody looked up somebody's record they shouldn't have or something along those lines. It happens. Well, the knee-jerk reaction is everybody needs to get educated on HIPAA again. The problem is that doesn't cause a change in outcomes. The person who looked up somebody's medical record knew they weren't supposed to do that, but they still did it. That's a problem with the individual. Where we get into some issues, we get into this discussion about just culture and peer review and saying, well, people aren't bad. And they're not bad. They just did something that was against the policy. What happens is if somebody knows what to do, understands it, and chooses not to, or chooses to do something they're not supposed to, that's a disciplinary problem. And that's not something that's necessarily a learning problem. What happens is the gut reaction has been, well, let's put another module online and that'll fix it. And it doesn't. I was talking with one regulatory review person and said, well, I want to put such and such a module online. I said, okay, great. I said, you realize that will not get you the outcome? They said, yeah, but it checks the box that I did it. Well, if that's what you're doing, please don't waste learning resources. Sometimes we have to do that, but we need to understand that's what we're doing. Because otherwise what happens is they come back to learning and go, well, why isn't that fixed it? If we go back to the example I've used a couple of times of hand washing, well, keep trying to fix it by putting more education. It doesn't work. We need to actually address the problem that's there. Another great example of this would be patient experience. Let's educate everybody again about how to interact with the patient. Let's use a different model this time. Let's change from the Studer model to Disney or whatever. It doesn't matter which model. Well, the problem is we haven't changed the environment people work in. You know, if we're looking at it and saying, okay, well, they cut corners because they were short-staffed and now they got a lower HCAP score, well, that's a management problem, not a learning problem. Now, that being said, there are some things that are learning problems. If people don't understand what to do, they don't understand how to do it, they don't get it, they're unconsciously incompetent, that's a learning problem. Once somebody is consciously competent or higher, that's a management problem. Now, the hard part is in learning, people go, well, I can't push back. Well, you need to pick the right battles to push back on. Because what happens is if we ask the question, are you doing this for a checkbox or to improve the outcome? Often they'll say to improve the outcome, and we may have to do a different initiative. Go back to problem identification to figure out what it is. Sometimes the answer, maybe we need to do some management training. That's okay. We need to figure out ways to do that. Because what happens is when we go and decide everything's a learning problem, we end up with way too much education, not enough learning. We have all these courses, hours and hours and hours, online classroom, that don't fix a problem. That then the learner tunes out what is actually a learning problem. Great example of this is we do annual competency education. Annual competency education is checking a box to say we did it. Well, the Joint Commission has gotten smart and they said, well, now we're going to put tracers to see, do people actually do what they're supposed to? Well, we're going to have to change things on both the management and learning side to do that. What happens is people want to learn when the Joint Commission is coming because they know they're going to be tested. Well, that's just teaching to the test. That's not changing behavior. We need to figure out, is it a learning or a management problem before we try to address it? And what we need to do is weed out those things that are management problems so we're just focusing on the learning ones. The result will be we're following the adult learning principle of adults learn what they want to learn when they want to learn it. What they'll find is the things they want to know are in the learning management system or in courses, and it's not like they feel like they're getting beaten down. Your challenge is to look at a process and say, well, what's broken? Is it the learner, their experience, or their environment? If it's the learner, that's probably a learning problem. If it's experience or environment, that's probably a management problem. You need to find the balance and make sure you use resources appropriately to fix the problem.